was a chemistry actually that was based using an enzyme that was discovered in Yellowstone National Park.
Personalized medicine presents a huge opportunity for pathology because personalized medicine is getting the right treatment to the right patient at the right time. And all of that depends on an accurate and appropriate characterization of the disease process. A cornerstone of personalized healthcare is molecular diagnostics, molecular genetic pathology, and pathologists who embrace the ability to engage in these future diagnostic opportunities, to seize these tools, to understand how to use them, to understand what they mean for their colleagues, to help their colleagues use these tools, are going to do incredibly well. Pathologists are going to be called upon to go beyond diagnosis, even in the work they do daily. Going beyond diagnosis means not just reaching the diagnosis, but then biologically characterizing a malignancy, helping to understand a clotting disorder, interpreting those lab tests, and helping to direct the care of the patients, helping to direct the therapy and the management of those patients. That's a role that traditionally pathology has not been as actively engaged in, but is part of the transformation of pathology. If pathology doesn't transform itself, if there isn't this change to rediscover our roots as physicians who are really fundamentally thinking about and directing the care of patients, I think there is the risk that pathologists will increasingly lose status within the house of medicine and will begin to see an erosion of reimbursement, an erosion of their essential role. And finally, that will impact patient care because the lessons that pathologists have learned through the years about how to best manage diagnosis, make accurate diagnosis with respect to quality control, making sure the tests are run appropriately, you get the right answer, all of those lessons that pathologists have learned will potentially be lost. And what I think is going to happen, pathologists engaging in the transformation, pathologists who seize the opportunities of personalized healthcare, I think are going to become a pivotal player in the advances that personalized healthcare makes possible. So what can a pathologist do now to engage? Well, pathologists first need to become familiar, not afraid of the new technologies, of the new concepts that genetics represent in the characterization of disease. We then, once we become comfortable with those concepts, educate our colleagues. Educating our colleagues is something we can be doing that will very much contribute to the advances in healthcare and personalized healthcare.